Do you have 5 tubes of varicose vein cream sitting on your shelf right now, and by the evening, are your legs throbbing so much, it feels like you've just run a marathon? It's a familiar misery, isn't it? We spend money, we spend hours slathering on these gels and creams, praying for some sort of miracle. But what if I told you that, at a certain point, all those ointments become absolutely pointless, and sometimes they can actually do more harm than good? Now, in this video, we aren't here to push the next wonder cure. Instead, we're going to look at 5 clear, undeniable signals that scream at you. Stop the rubbing! It's time to call the doctor. Stick with us until the end, and you'll find out how to spot that crucial tipping point when simple discomfort can escalate into a real threat to your health. By the way, what's your experience been with these vein creams? Do they help, or are they just money down the drain? Let me know in the comments below. Let's be straight about this. What exactly is varicose disease? It's not just a few unsightly blue spider veins or slightly bulging ropes under the skin. Imagine a one-way street. Healthy veins have these tiny valves, like miniature one-way gates, that let blood flow only in one direction, up toward your heart. With varicose veins, those crucial gates break down. The blood starts to pool, and it stretches the vein walls, just like an old elastic band that's lost its snap. This happens, especially as we get older, and our blood vessels lose their vital elasticity. And this is where the creams come in. They can certainly offer temporary relief. They might cool things down, take away the heavy fatigue, or perhaps slightly reduce the swelling. But what they absolutely cannot do is repair a broken valve deep inside your vein. They work purely on the surface, while the real problem, that crucial damage, is hidden far beneath. Understanding this is truly the first step toward finding the right treatment. Right then, let's start with the absolute fundamentals. Why do we have such strong faith in these creams and lotions? It's simple, really. They're easy to pick up, straightforward to use, and they don't feel threatening. You nip down to the chemist, dab it on, and you feel a temporary relief. The blandishments of advertising promise us lighter legs and claim the problem will be gone in just a few applications. This creates a dangerous illusion of control over the situation. We genuinely think we are treating the underlying problem, while the actual condition continues to progress silently beneath the surface. Creams, at best, only tackle the symptoms. They might contain ingredients like heparin to slightly thin the blood near the surface of the skin, or perhaps horse chestnut extracts to supposedly tone up the vein walls. It's exactly like opening a window to let the smoke out when your house is on fire, instead of actually putting the flames out. Yes, you can breathe a little easier, but the house is still burning down. This is precisely why the first step towards a sensible approach is accepting that a tube of cream is not a cure for varicose veins. It is nothing more than a temporary aid for minor discomfort, only useful in the very earliest stages, and frankly, nothing more than that. Let's take a proper peek right inside the troublesome vein itself. As we've discussed, the little valves aren't working properly, and the blood starts pooling or stalling. This puts serious pressure on the vessel walls. The vein stretches out and becomes twisted, that familiar bulging look. Now, the cream you're rubbing onto your skin simply cannot physically penetrate deep enough to influence that fundamental mechanical problem. The active ingredients only really work on the very top layers of the skin and the tissue just beneath. They might temporarily constrict tiny capillaries or boost surface circulation a little, and that's what gives you that fleeting sensation of relief or lightness. But can they fix a broken valve? Can they reinforce that stretched out vein wall from the inside, or force the sluggish, pooled blood to move correctly? Absolutely not. Think of it this way. Imagine you have a burst pipe buried deep inside the wall, and your solution is simply to wipe the damp patch on the wallpaper. That's precisely what happens when you use creams for advanced varicose veins. You're treating the visible symptom, while completely ignoring the genuine plumbing disaster underneath. Right then, let's look at the first serious sign, that persistent, unrelenting ache and heaviness in your legs. We need to draw a distinction here. It's one thing if your legs are tired after a good long walk, or a busy afternoon, pottering in the garden. That's just natural fatigue, and it disappears after a proper rest. But it's quite another thing when you feel like you have lead weights tied to your ankles before lunchtime, even if you haven't really exerted yourself, when that dull, throbbing, or even burning pain in your calves becomes your constant companion every single evening. A simple rub-on cream might give you a temporary cooling sensation, making you feel better for half an hour. But the underlying issue, venous blood pooling, pressing on your tissues, and irritating those nerve endings, that hasn't gone anywhere. If you find yourself reaching for a pain-relieving cream just to get a decent night's sleep, if this discomfort is stopping you from living life to the fullest, then this is your venous system sending out a loud distress signal. It's overloaded and desperately needs proper medical attention, not just a superficial fix. We need to truly understand where this pain is coming from. It's crucial to realise that this isn't just a simple muscle ache. It is fundamentally different. Patients often describe it as a deep, internal pressure, a throbbing fullness, or those dreadful night cramps that force you to jump straight out of bed. Others report that characteristic tingling, or pins and needles sensation. So, why does this happen? Stagnant venous blood, the blood that isn't moving properly, is low on oxygen and filled with metabolic waste products. This used up or toxic blood literally irritates and poisons the surrounding tissues, muscles and nerves. This is the direct cause of those spasms, cramps and uncomfortable sensations. Furthermore, the increased pressure within the vein forces the liquid component of the blood to leak through the vessel walls and into the surrounding soft tissues. This creates a hidden internal swelling, known as edema, which squeezes everything nearby. That's what causes that classic feeling of pressure, bursting, and overwhelming heaviness. Now understand this. No topical cream can possibly remove this excess fluid or properly reoxygenate the tissues. They simply distract your nerve endings temporarily, usually with a cooling effect like menthol, creating a temporary illusion of relief, while the underlying pathological process continues to worsen. Right then, the second sign, and this one is usually much more obvious, persistent and visible swelling. If, by the evening, you notice deep indents left on your ankles by the elastic of your socks and your favourite pair of shoes start feeling awfully tight, that's a real warning sign. You really need to pay attention if that swelling doesn't completely disappear after a good night's rest. You wake up in the morning and your legs still look a bit puffy, maybe even slightly heavy or doughy. This tells us that your body's plumbing, specifically your venous and lymphatic systems, is struggling to drain the fluid away properly. Consistent swelling isn't just about how your legs look, is it? It's like having a stagnant pool building up in your lower legs. This sluggish fluid allows toxins to accumulate, which then damages the skin and the tissue underneath. That makes your skin much more vulnerable to any kind of infection. Creams designed to reduce swelling might give you a tiny short-term lift, but they won't fix the root of the problem. They can't deal with the high pressure in your veins that is forcing all that liquid to constantly leak into your tissues. Ignoring persistent swelling is essentially opening the door to far more serious health complications down the line. But why exactly is swelling so dangerous? To understand this, let's picture a simple sponge. When it's dry, it feels light and supple. Soak it in water and it becomes heavy. Leave that sponge submerged for too long, and it will eventually start to break down and perhaps even rot away. That is essentially what happens to the tissues in your legs when you suffer from chronic edema. This constant presence of excess fluid crucially interrupts the normal nourishment of your cells. They are literally starving, trapped in this stagnant fluid which is depleted of vital oxygen and essential nutrients. This often causes the tissue beneath the skin to thicken and harden, sometimes feeling quite firm or tough to the touch. Simultaneously, your skin loses its natural elasticity and its vital protective functions. A simple scratch or an insect bite on a swollen leg takes far longer to heal and is much more likely to become infected. Edema isn't just water buildup. It is a clear sign of a significant underlying metabolic disturbance within the tissues, usually caused by venous insufficiency. This is a condition that requires a complete, systemic approach to treatment, rather than simply relying on rubbing in a topical gel. Now the third warning sign, one you really shouldn't ignore, but which people often put down to just getting older or some other minor issue, is changes to your skin. Take a good, close look at the skin on your lower legs, particularly the area just above your ankles. If you start seeing brownish or reddish-brown patches, almost like old bruises or large freckles that simply won't fade away, that's a serious indicator. Medically, we call this hyperpigmentation. This happens because high pressure in the veins forces tiny blood cells, the red ones, to leak out into the skin tissue. Once there, they break down, releasing hemoglobin, which is rich in iron. It's this iron that essentially rusts the skin, giving it that characteristic rusty colour. Alongside these discoloration patches, the skin might become severely dry, flaky, and you may experience an absolutely unbearable itch. People often reach for moisturising creams or try to treat what they think is standard dermatitis or just dry skin, completely missing the fact that the actual problem lies much deeper in the blood vessels themselves. This condition, known as venous eczema, is a direct result of the poor circulation and inadequate nourishment of the skin caused by underlying varicose veins. Let's break down the biology behind these skin changes. Our skin is a living, breathing organ. It requires a constant supply of oxygen and nutrients, and just as importantly, it needs to get rid of waste products. This essential exchange is managed by an intricate network of tiny blood vessels called capillaries. When you have varicose veins, the large veins become congested, and this excess pressure is transferred right down to these microscopic vessels. They become engorged with blood. Their delicate walls stretch, and they start to leak. This leakage triggers chronic inflammation in the surrounding skin. The body tries to fight this reaction, but because the root cause, the venous congestion, hasn't been addressed, the inflammation becomes permanent. Consequently, the skin thins out. It becomes shiny, almost like parchment, and starts to lose its hair. It becomes fragile and defenseless. This isn't just a cosmetic concern anymore. It's a clear signal that the tissues in your legs are suffering from chronic oxygen deprivation and toxicity, and no amount of cream, not even the most expensive ointment on the market, can restore healthy circulation at this foundational level. We often run into a common misconception here. People tend to say, "Oh, that's just age," or "I simply have dry skin." Many older people notice their legs darkening and just dismiss it, putting it down to those common age spots or liver spots. But there's a crucial difference. Age spots can crop up anywhere on the body. Pigmentation linked to varicose veins, however, is very specific. It's usually concentrated around the lower third of the shin, near the ankles. The same principle applies to dryness. If your skin is generally dry all over, that's one thing, a different story entirely. But if you have unbearable itching and flaking focused specifically on your shins, especially where you already notice prominent veins or swelling, there is a 99% chance that you're looking at a symptom of venous insufficiency. Trying to treat this simply as common dermatitis is like trying to paint over a rusty pipe. It might look nice on the outside for a bit, but the corrosion is still going on inside. It's vital to look at the overall picture. Do you have a feeling of heaviness, swelling, or visible veins? If the answer is yes, then any changes to your skin aren't a sign you need a new expensive moisturizer. They are a sign that you need to book an appointment with your GP or a specialist. Our fourth warning sign is when you can actually feel the seriousness of the issue, not just see it. Gently run your hand along the length of the swollen vein. If you feel a hard, painful lump or cord under your fingers, and the skin over it is red and feels hot to the touch, this is an incredibly serious situation. This is a sign of thrombophlebitis, inflammation of the vein wall where a blood clot, or thrombus, has formed inside. At this point, creams and ointments aren't just ineffective, they can actively cause harm. For instance, using warming rubs or aggressively massaging the area is absolutely contraindicated, as these actions can cause the clot to detach. That is a direct threat to life, as the clot can travel through the bloodstream right to your lungs, causing a potentially fatal condition known as a pulmonary embolism, or a PE. Any sign of hardening, persistent redness, or localized heat along the path of the vein is an absolute reason to seek immediate, urgent medical attention. So what exactly is thrombophlebitis? Put simply, imagine a very slow-moving river where the current almost grinds to a halt. Silt and debris naturally start collecting and settling on the riverbed. The same process happens inside a varicose vein, especially where the blood flow is sluggish. The components of your blood, the platelets, start clumping together and sticking to the damaged wall of the vessel. That's how a blockage, or a clot, forms. Your body sees this clot as a foreign invader and immediately triggers an inflammatory reaction. That's why you get the telltale symptoms: pain, redness, and localized swelling. Now, if the clot stays put in a superficial vein, it's generally just a nuisance. The real danger, however, is that it can grow, potentially spread, into the deeper veins, which is deep vein thrombosis, or worse, a piece of the clot might break off entirely. That's why, if you have even the slightest suspicion of thrombophlebitis, self-treating is absolutely off limits. Only a doctor using an ultrasound scan can properly assess the size of the clot, its exact location, and the degree of risk. After that, they can prescribe the correct treatment, which is aimed at dissolving the blockage and stopping it from growing any further. And finally, the fifth, most alarming, and sadly not uncommon sign, is the appearance of persistent, non-healing sores on the skin. This might begin as something small, a little blister, a simple scratch, or just a damp, weeping patch of skin that slowly develops into an open wound. This is known as a venous or trophic ulcer. It truly represents the tip of the iceberg, the final, most severe stage of chronic venous insufficiency. Its appearance signals that tissue nourishment has been so severely compromised that the skin is literally dying and being rejected. These ulcers typically form on the inner surface of the lower leg, just above the ankle bone. They can be incredibly painful, often smell unpleasant, and are highly resistant to standard wound healing treatments. Trying to treat this condition with simple creams and ointments is frankly like attempting to put a small plaster over a gaping hole in a ship. Without restoring proper venous drainage, the ulcer will simply never heal and will only continue to grow in size. Why are venous ulcers so incredibly difficult to heal? It's because the main issue isn't the wound itself, but the underlying ground or environment where the wound developed. As we've discussed, the skin and underlying tissues in this area are essentially poisoned by the waste products of stagnant blood and are severely starved of vital oxygen. In these conditions, the body simply doesn't have the resources needed to repair itself. Any bacteria that enter the wound thrive, leading to constant inflammation and persistent infection. Patients spend years going for endless dressings, wasting huge amounts of money on expensive antibiotic and silver-based ointments and specialized bandages. They only ever see a temporary improvement. The ulcer shrinks down, only to flare up and break open again. The only truly effective way to treat these ulcers is to eliminate the root cause. This means addressing the underlying varicose veins and restoring healthy, normal blood flow. As soon as healthy, oxygen-rich blood starts flowing back into the tissue, the body automatically kickstarts its natural regeneration process, and the ulcer finally heals. Let's just take a moment to imagine what happens if we choose to ignore these 5 critical warning signs and continue to rely solely on topical creams. Persistent pain and that constant feeling of heaviness will inevitably lead to reduced mobility, apathy, and perhaps even depression. Chronic swelling, in turn, puts a tremendous strain on both your heart and your lymphatic system. Skin changes quickly progress to what's known as white atrophy, where the skin becomes fragile, thin as tissue paper, ready to split open at the slightest knock. Meanwhile, thrombophlebitis carries the dreadful, ever-present risk of a fatal pulmonary embolism. And finally, that stubborn, non-healing trophic ulcer is not merely a source of constant pain and infection. It also carries the risk of the surrounding tissues developing malignancy. Ultimately, a problem that could have been solved early on with a simple, minimally invasive procedure performed in just a day, transforms into a chronic, utterly draining condition that poisons your everyday life and requires prolonged, complicated treatment. The real price of hesitation here isn't measured in money, but in the years of healthy, fulfilling life you forfeit. Right then, you've noticed one or two of these telltale signs, and you've decided it's time to finally do something about it. So, what exactly happens when you go to see a vein specialist? Well, there's absolutely no need to worry. Your first visit is mainly about having a chat and a quick checkup. The doctor will listen carefully, asking detailed questions about your concerns, when they started, and what seems to make them worse. They'll examine your legs, checking your veins, skin, and looking for any swelling. This is completely painless, by the way. The specialist's only goal right now is to build a full picture of your health. They certainly won't wheel you straight into surgery or try to frighten you with doom and gloom. In fact, a good professional will put your mind at ease and clearly explain what's going on with your veins and what practical options are available to help. Modern vein care is a far cry from the old days of fear and discomfort. It's all about new technology, comfort, and getting you back to your active life as quickly as possible. So please, put those worries aside and take that first, absolutely crucial step. The most crucial part of your first visit is the venous duplex ultrasound scan, or simply the Doppler scan. This is considered the gold standard for accurately diagnosing varicose veins. The procedure itself is completely painless and perfectly safe. It's just like having any other standard ultrasound test. Your doctor will simply apply a special gel to your skin and gently move a probe along your leg. On the monitor screen, they can see your veins working in real time, checking their diameter, the condition of the vein walls, and, most importantly, how your valves are operating. The scan shows exactly where a valve might be failing, causing blood to flow backwards, which is what leads to problems. Crucially, the doctor can also assess if there are any blood clots present, determining their size and potential risk. This one investigation provides comprehensive, exhaustive information about the exact health of your entire venous system. Based on these precise results, your doctor can then give you an accurate diagnosis and propose a treatment plan tailored specifically to your needs. There's no more guesswork or treating the problem in the dark. Just accurate diagnostics and focused treatment aimed exactly at the root cause of the issue. Let's tackle the biggest worry that prevents people from seeking help, the fear that you'll be rushed into a major operation under general anaesthetic, requiring your leg to be cut open, followed by a long, painful stay in hospital. Put those fears out of your mind. Classic vein removal surgery, or phlebectomy, is performed increasingly rarely today, reserved only for the most advanced or severe cases. Nowadays, 95% of all varicose vein cases are treated using modern, minimally invasive methods. These procedures are done on an outpatient basis, often referred to as a day case. You simply come to the clinic, have the procedure, and you'll be walking home on your own 2 feet within an hour or two. They do not require a general anaesthetic, just simple local anaesthetic is used. There are absolutely no surgical cuts or scarring left on the skin, just tiny pinprick marks that heal almost instantly. The recovery period is minimal. In fact, most patients are back to their normal daily routine the very next day. Therefore, the old fear of a serious operation is now completely unfounded and simply not relevant. One of the most popular and effective modern treatments is called endovenous laser ablation, or EVLA for short. Now that might sound very technical, but the procedure itself is actually quite straightforward. Using guidance from an ultrasound machine, the doctor makes a tiny pinprick and gently threads a slender laser fibre into the vein that is causing the trouble. Once the laser is switched on, its energy precisely heats the inside wall of the vein, essentially sealing it shut. This process instantly stops the vein from functioning, and the blood is naturally diverted to the other healthy vessels. The sealed vein eventually just shrinks away and is absorbed by the body. The entire treatment usually takes between 40 and 60 minutes. It's performed under local anaesthetic, so you'll be comfortable, and it leaves virtually no scarring. This is a definitive solution. If the troublesome vein is gone, the varicose vein problem is solved. The success rate for this method is exceptionally high, reaching up to 98%. Evlay is a true 21st century technology, allowing you to get rid of varicose veins quickly, safely, and permanently. Another popular and effective modern method is sclerotherapy. This is ideal for getting rid of those pesky spider veins, as well as smaller varicose veins. The procedure involves using a very fine needle to inject a special solution, called a sclerosant, directly into the affected vein. This substance gently irritates the inner wall of the vein, causing it to seal shut. Once sealed, the vein gradually shrinks and disappears over time. The procedure is practically painless and usually only takes about 15 to 20 minutes to complete. Occasionally, a patient might need a couple of sessions to achieve that perfect finish. Sclerotherapy is often used alongside laser treatment. It helps tidy up any remaining smaller veins and ensures you get the best possible cosmetic outcome. This is yet another example of how modern vein care allows us to solve these problems without surgery, significant pain, or a lengthy recovery period. There are many effective treatment options available, and your doctor will work with you to find the one that is absolutely best suited for your specific needs. So, what's the main takeaway from all this? Varicose veins are simply not a condition that will clear up on its own, and they certainly aren't something you can cure with a bit of ointment or a magic cream. Seeing your doctor early isn't just about the aesthetics of your legs, it's a genuine investment in your long-term health, mobility, and overall quality of life. By tackling the root cause of varicose veins early, you not only get rid of the pain and swelling, but you also prevent the development of serious, life-threatening complications, things like thrombophlebitis and chronic leg ulcers. You save money you might otherwise spend for years on useless creams and dressings that simply don't work. And most importantly, you reclaim your freedom of movement and the simple joy of living life without constant discomfort and pain. Please don't put off seeing a vein specialist. The sooner you act, the simpler, quicker, and cheaper the solution will be. Take care of your legs because they still have many faithful years of service ahead of them. Let's wrap things up now, shall we? We've covered 5 crucial telltale signs: that persistent ache and heavy feeling, swelling that just won't go down, changes to your skin, hardened patches in the veins, and finally, the appearance of ulcers. Please remember, the key takeaway from this video: creams and ointments are simply not a cure for varicose veins. They only offer temporary relief for symptoms, and usually only in the very early stages. Relying solely on them means you are effectively letting the condition damage your veins from the inside out. Seeing a specialist, a phlebologist, in good time is nothing to be afraid of. Nowadays, we have modern, quick, and almost entirely pain-free procedures that solve the problem once and for all. Please don't wait until complications arise. Get ahead of the problem. Your health and your quality of life truly are in your hands. Thank you for watching this important video right to the very end. If you found this information helpful, please do give us a like and subscribe to our channel so you don't miss our future health updates. And finally, do let us know in the comments below which of these warning signs made you stop and think the most. Sharing your experience might just help someone else.